Welcome to Lesson 3 of our DSM-5-TR series. Today we are exploring communication disorders, a group of neurodevelopmental conditions that affect how people understand, produce, and use language and speech. These disorders typically begin early in childhood and can greatly impact learning, relationships, and daily functioning. The DSM-5-TR identifies five main communication disorders: language disorder, speech sound disorder, childhood onset fluency disorder, social pragmatic communication disorder, and unspecified communication disorder. Let's go through each one in detail. Language disorder is defined by persistent difficulties in acquiring and using language in spoken, written, sign, or other forms due to problems with understanding or producing language. People with this condition may have a reduced vocabulary, difficulty putting words together into correct sentences, or trouble using language to explain, describe, or tell stories. Language abilities are noticeably below what is expected for a person's age and cause real-world problems in communication, social participation, or academic performance. Symptoms begin early in development and are not caused by hearing loss, sensory issues, motor problems, neurological conditions, or intellectual disability. Children with language disorder may start speaking later than expected, use fewer words, and form shorter or grammatically incorrect sentences. They might struggle to follow complex instructions or to tell coherent stories. If difficulties persist beyond age 4, they often continue into adolescence and adulthood, although they may change in form over time. Receptive language problems, where understanding language is harder than using it, usually predict more challenging outcomes. Genetic factors play a significant role, and family history is common. Bilingualism does not cause language disorder, but both languages should be assessed carefully. It is important to distinguish language disorder from normal language differences: hearing impairment, intellectual disability, autism, and acquired aphasia. It often occurs together with other conditions such as speech sound disorder, specific learning disorder, ADHD, autism, or developmental coordination disorder. Speech sound disorder involves persistent difficulty producing speech sounds, which reduces how understandable speech is or prevents effective communication. Children with this condition may have errors due to limited knowledge of how sounds work or difficulty coordinating their speech muscles. By age 3, most children's speech should be mostly understandable, and by age 5, most speech sounds should be correct. The condition causes problems in communication, school, and social life, and it starts early in development. It is not caused by conditions like cerebral palsy, cleft palate, hearing loss, or brain injury. It may co-occur with difficulties in mouth or tongue coordination, and a family history of speech or language disorders is common. Most children improve with age and therapy, and boys are more frequently affected. Risk factors include premature birth, low birth weight, and chronic ear infections with hearing loss. Speech sound disorder must be differentiated from normal speech development: hearing loss, structural issues, motor speech disorders, and selective mutism. It may occur with specific learning disorder, ADHD, autism, or social communication disorder. Childhood onset fluency disorder, commonly called stuttering, is a disturbance in normal speech fluency and timing that is unusual for the person's age. This may involve repeating sounds or syllables, prolonging sounds, breaking words apart, blocking speech either audibly or silently, using substitute words to avoid certain sounds, speaking with physical tension, or repeating single-syllable words. This condition causes anxiety about speaking and limits effective communication, social interaction, and academic or work performance. It starts in early childhood and is not caused by speech motor or sensory deficits, neurological damage, or another mental disorder. The severity often varies depending on the situation and tends to increase with stress. Physical behaviors such as eye blinking or facial tension may accompany speech blocks. Anxiety can make the symptoms worse. Onset usually occurs between ages 2 and 7, with most cases appearing before age 6. Many children improve, but those with more severe early symptoms are more likely to have persistent problems. Stuttering is more common in males, often runs in families, and is associated with differences in brain regions involved in speech and language. It should be differentiated from sensory deficits, normal speech patterns, learning disorders related to reading, effects of bilingual language use, adult-onset speech disturbances, and conditions such as Tourette's disorder. It may occur alongside ADHD, autism, intellectual disability, speech-sound disorder, or specific learning disorder. Social pragmatic communication disorder involves ongoing difficulties in the social use of verbal and nonverbal communication. People with this condition struggle with using language for social purposes, adjusting communication to fit the context or listener, following the rules of conversation and storytelling, and understanding non-literal or ambiguous language such as idioms, jokes, or metaphors. These challenges cause significant problems in communication, relationships, academic achievement, or work performance. Symptoms begin early in development and are not better explained by another medical or neurological condition, low cognitive ability, or autism spectrum disorder. The primary issue is how language is used socially, not grammar or vocabulary. Difficulties often become clearer as social demands grow, such as when a child enters school. Family history of autism, communication disorders, or learning disorders increases the risk. It must be distinguished from autism spectrum disorder, where restricted and repetitive behaviors are present, ADHD, where attention deficits are the main problem, and social anxiety disorder, where skills are present but not used due to anxiety. It may occur together with language disorder, speech-sound disorder, ADHD, learning disorders, or anxiety disorders. Unspecified communication disorder is diagnosed when communication difficulties cause significant impairment, but do not fully meet the criteria for a specific communication disorder, or when there is not enough information to make a more precise diagnosis. This diagnosis is sometimes used in emergency situations or when evaluation opportunities are limited. In summary, communication disorders affect how language and speech are produced, understood, and used socially. They begin early in development and often require early intervention to improve outcomes. Accurate diagnosis depends on understanding the key features, developmental patterns, and conditions that might look similar. In the next lesson, we will focus on autism spectrum disorder, which overlaps with communication disorders but includes additional patterns such as restricted and repetitive behaviors.